So you went to your doctor, you have frozen shoulder, and they said your hormones have nothing to do with it. So in 2022, Duke actually did a research study, and this particular doctor connects estrogen and frozen shoulder in menopausal women. This study was presented at the North American Menopause Society, and let me show you. According to the study led by Duke Health researchers, postmenopausal women on hormone replacement therapy had a lower risk of developing a painful shoulder condition known as adhesive capsulitis, or frozen shoulder, than women who did not receive estrogen. Now let me build this story for you. Estrogen plays a role in stimulating bone growth, reducing inflammation, and promoting connective tissue integrity. Not using systemic hormone therapy was associated with a higher risk of adhesive capsulitis. Now let me build this story for you a little more. If we believe that hormones can cause an increased risk of rupture of ligaments such as the ACL in women, such as teens, we know that after ovulation in the luteal phase, you are more likely to tear tendons and ligaments. Think ACL tears, right? Would it be crazy to think that when estrogen leaves, the opposite happens? You would become less loose, more tight. Why is it acceptable for young athletes to have a hormonal change in their ligaments when their hormones come on, but unacceptable for women when they lose hormones that the tightness comes on? We know this to be true, but remember, women's health research is so bad if you're over 40, if you're menopausal, perimenopausal, postmenopausal. Research is rarely about you. So if it's a condition such as that is tied to our hormones, you're not going to see a lot of research yet, but you will. So given that older women are most commonly affected by adhesive capsulitis, there may be a connection between the loss of estrogen and menopause and the painful shoulder condition. Among the women in the study, only 3.95% of those who received hormone replacement therapy were diagnosed with adhesive capsulitis, compared to 7.65% of women who did not receive estrogen replacement. But the researchers said this should drive further investigations. So let's talk about future research. So we know that when your hormones shift, perimenopause, menopause, arthralgia is real. And really, we know it's in the shoulder. Look at this, perimenopausal arthralgia. And in this particular research study for perimenopausal arthralgia, the most common diagnosis in these groups was adhesive capsulitis, 35.4 to 31.8%. So common things happen commonly. The second most common thing was a shoulder synovitis, and these conditions improved with a treatment of oral prednisone. They state that we should further investigate the relationship between menopause and shoulder arthralgia. Oh, look, another study, prevalence of frozen shoulder in postmenopausal women, a cross-sectional study. Because when women's menstrual cycles change, so do their tendons, ligaments. But remember, women's health is rarely really studied when it comes to orthopedic. And guess what they found in this particular study? This study also found that there is a substantial association between menopause and frozen shoulder in women. Also, the reduction of stress and improvement of quality of life results in helping menopause and frozen shoulder. Now, this is recognized in other cultures. So when you look at traditional Chinese medicine, yes, they do know that menopause and adhesive capsulitis happen. It's one of the number one complaints of women in Japan. So frozen shoulder occurs when ligaments of the shoulder become swollen and stiff, and this is already well-established link with diabetes. So this is thought to be because of high glucose, blood sugars, impaired circulation, and causes the tendons to stiffen up. But could it be that when we lose estrogen, our tendons and ligaments also stiffen up because estrogen helps us? Also remember, estrogen controls inflammation. So estrogen contributes to the stimulation of bone growth, reduces inflammation, as well as strengthening connective tissue. Do you see why perimenopause, menopause, and frozen shoulder are a thing? It is not the only thing. Other things can cause it, but hormone changes affect women's tendons. We need to talk about orthopedics in women because women are not little men. But wait, guess what? It's going to happen. Women's health is going to get more funding because Jill Biden just did a press call announcing the White House's initiative on women's health research, looking at things such as menopause, osteoporosis. We should really add frozen shoulder for women on this. So yeah, this press release said that women's health should be made important. So even though the research is still quite fresh on adhesive capsulitis, which is also known as frozen shoulder, in women that are perimenopause and menopause, the research is coming. It's happening. And also once the research happens, know that it's going to take 5, 10, 15, 20 years for doctors to actually even realize and put that into practice. And this is why I encourage everybody who is taking care of menopausal women to actually look at the North American Menopause Society, which is now called the Menopause Society. And if you have a high caseload of menopausal women, they're really different. Women are not little men. If you are applying the way you used to do medicine 50 years ago to women today, this is a great injustice. We have realized the research that was done on men is not always applicable to women. Hit the plus sign and follow for more women's health wellness tips. Bye.